Now moving to the next artery of importance, we're looking at another artery in the upper limb, and this is what is known as a posterior ulnar recurrent artery. Posterior ulnar recurrent artery. So let's quickly look at it. This is the posterior ulnar recurrent. So the posterior ulnar recurrent artery is actually one of the two recurrent arteries, the other one being the anterior ulnar recurrent. Okay, so it passes from the ulnar artery and it ascends posteriorly to the medial epicondyle of the humerus. So it's a branch of the ulnar artery, usually just distal to the origin of the anterior ulnar recurrent artery. Let's identify. This is a posterior ulnar, right? Let's identify it again. Posterior ulnar. Okay, anterior and posterior ulnar recurrent, right? But just facing on the one that goes to the back. So this artery ascends posterior to the medial epicondyle of the humerus, runs between the flexor carpi ulnaris and the flexor digitorum superficialis muscle. So it reaches the posterior aspect of the elbow joint. So distribution, it gives blood supply to the elbow joints, the flexor carpi ulnaris and the adjacent muscles, also the medial epicondyle region. So anastomosis, it joins the superior ulnar collateral arteries and connects with the inferior ulnar collateral artery. So contributes to the arterial anastomosis, that's the blood supply around the elbow. That's just the importance, So it's important in maintaining collateral blood supply. It's also relevant in surgical approaches in the elbow, and maybe in cases of trauma or issues around the medial epicondyle.